All right, welcome to your Honors Anatomy and Physiology Marking Period 2 review. I will post another one hopefully tomorrow, or I guess definitely by tomorrow night, for Marking Period 1 for your midterm for Period 3 on Thursday. The chapters covered in this midterm from Marking Period 2 include Chapter 7, which is on the skeleton, Chapter 8, which is on joints, Chapter 9, which is on muscular physiology and tissue details, and Chapter 10, which is on the human musculature. As far as Chapter 7, there won't be anything on the specific bones that we went over, all the memorization we did of the various markings. You should generically know the difference between the appendicular and the axial skeleton. Recall that the axial skeleton, if you drew a line down the center axis of the body, the areas of the skeleton that you're hitting include the skull, the ribs. Oh, I knew I forgot something. Where's his ribs? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. The skull, the ribs, the vertebra, and the sternum. And that would make up your axial skeleton. Skull, sternum, vertebra, and ribs. The appendicular skeleton, for appendicular, think of appendages. So these include the limbs, the arms, the legs, and the girdles they're associated with. So that includes for the legs the pelvis, and for the arms the scapula and the clavicle. Concerned, recall the abnormal curvatures. So from a lateral view, an abnormal thoracic curvature is called kyphosis. An abnormal lumbar curve is called lordosis. And remember, that's from a lateral view. From a posterior view, what we should see in a normal spine, the spine should look straight. But in scoliosis, there is a curve to the spine. So not a lateral view, but a lateral curve. From Chapter 8 on the joints, you should know your main joint movements. Again, these were paired. You have abduction and adduction, movement along the frontal plane of the body. You have flexion and extension, which is movement in the sagittal plane. These are the main pairs. There's a host of other movements. You should look over them generally. Plus others. As far as structurally, in terms of the joints, recall that fibrous joints like sutures in the skull are immovable. Cartilaginous joints, like in the pubic symphysis, are slightly movable, and synovial joints Synovial joints are freely movable, as in your ball and socket or hinge joints. Discussing the knee. There's your femur, your tibia. So recall there's 4 big ligaments holding your knee together: your ACL, your PCL, your MCL, and your LCL. And out of these 4 ligaments, it's the ACL, which often tears during athletic competition. The other thing from this chapter you should remember is what a bursa is. Recall a bursa as a sac, supplementary sac of synovial fluid, which acts to reduce friction at some of the more complex joints. The other components of your synovial joint included the membrane, synovial membrane, which produces the synovial fluid, the articular cartilage, which reduces friction, the capsule, and the ligament, which ties the bones together. While we're speaking of ligament and the tendon, ligament is a piece of connective tissue that connects 2 bones. A tendon is a piece of connective tissue that connects a muscle and a bone. My voice is probably panning out in between the slide advances. I apologize for that. In Chapter 9, the muscle physiology, there are several questions on the difference between skeletal muscle, cardiac muscle, and smooth muscle. So, nucleation or nuclei. Skeletal muscle is the only one that is multinucleate. The others are uninucleate. Striations. Skeletal muscle is striated, as is cardiac muscle. Smooth muscle is not. That's why it's called smooth. Voluntary. Skeletal muscle is voluntary. Cardiac and smooth are not. And you should know some examples of locations. Skeletal muscle, again, your skeletal muscles like your biceps, your triceps, your pectoralis, etc., etc. Cardiac muscle, that's obvious. Smooth muscle is found in your GI tract, the digestive system, and in the walls of blood vessels and organs like your bladder. You should know a little bit about your sarcomere. Recall your hierarchy, that a muscle is made up of bundles of cells called fascicles. Fascicles are made up of a large group of fibers, which are the individual cells. Fibers are made of fibrils, which are groups of filaments, and there are 2 types of filaments, thick and thin. And once you get to that filament level, that repetitive pattern of thick and thin filaments forms the functional unit of muscle, which is called a sarcomere.
Daddy.
Hi, baby.
Hi.
I'm working right now.
Can I watch you for a second?
Sure.
Okay. Oh, I wish I could try that.
I understand.
Why?
Yeah, I understand that you want to try this. Just let me finish, and then maybe I'll let you try later.
Hey, Daddy, yay! But, Daddy, can
You should also recall the sequence of events during contraction. So this starts, remember, with a nerve impulse.
Are you talking to me?
I'm talking to the computer, the iPad.
Oh.
The nerve impulse travels and reaches the SR, which causes calcium release from the sarcoplasmic reticulum. Recall that calcium binds to the blockers on the thin filament and removes them, which allows for the thick and thin filament to bind with each other. And you get the ratcheting of the thick filament, pulling the thin filament in towards the center of the sarcomere.
Oh, that's good.
It is good.
Because the sarcomere is up to the side.
Exactly. Very good. And last but not least, in human musculature, you should know the term antagonists. Antagonists are muscles that work in opposite, like the biceps. Those are muscles, yes.
Muscle means bones.
Exactly, very good. The biceps and the triceps.
Because I know what you're talking about the computer.
And when one muscle is contracted,
One muscle means
the other member of the antagonistic pair must be relaxed.
One muscle means relax
Good luck.
the muscle.
Yes, can you say good luck?